Antiviral drugs. Today we will discuss about the drugs which are used in the viral infections. The objectives of lecture, as per our blog booklet, describe the basic principles of prescribing chemotherapy for viral infections and describe the mechanism of action, pharmacological effects, indication, side effects, and contraindications of antiviral drugs. Let us see the objective one by one. The first one is basic principles of antiviral drug therapy. Generally, basic principle includes the mechanism of action of antiviral compounds must be selective to virus specific functions. Some of the more commonly targeted sites of actions for antiviral agents includes viral entry, absorption, penetration, and uncoating. Like some drugs act by the same mechanism. Amantadine and the rimantadine are the examples of the drugs. Some drug interfere with the viral protein synthesis, and these are the interferons most probably. Many of the approved antiviral drugs active against the herpes viruses are analog of the deoxynucleosides and subsequently inhibits the viral DNA polymerase. Some drugs interferes with the transcriptions or replications of the viral genome, like acyclovir, valacyclovir, cidofovir, famciclovir, penciclovir, foscarnet, ganciclovir, valganciclovir, ribavirin, and trifluridine. And some drugs interfere with the viral assembly, release, or deaggregations, and examples are oseltamivir, zanamivir, and some interferons. So these are the basic principles of the antiviral therapy, and most of the drugs act by the same mechanism of the action. Let us discuss the other slide. What happened here? Generally, the basic principles of the antiviral drugs should targets the viral sites. In the DNA viral replications, the normal metabolism process include attachment of the virus, then synthesis of the viral DNA, transcription into the messenger RNA, and there is a protein synthesis, assembly of the viron, and the release and the budding. So antiviral drug therapy, the basic principle should include the drug should interfere with the attachment, with the uncoating. Drug should interfere with the messenger RNA transcription and inhibit the viral DNA polymerase. And the drugs are acyclovir, vidarabine, foscarnet, ganciclovir. And drugs should also interfere with the assembly of the viron, budding, and the last one in the release. So these are the basic principles of the antiviral drug therapy for DNA virus. For the RNA virus, the drug should be interfere or inhibits the endocytosis, then the binding of the M2 protein. Target should include M2 protein, uncoating of the M2 protein like amantadine, rimantadine, and the drug should interfere with the messenger RNA transcription, replication. The drugs are the ribavirin. Drug should interfere with the assembly of the virus, and drug should interfere with the release of the virus. And the examples are oseltamivir, zanamivir, and the piramivir. So these are the basic principles of the antiviral drug therapy by which the drug generally act. Now we will discuss today about the drugs for the herpes, drugs for the influenza, and drugs for the hepatitis B and hepatitis C virus. Drugs for HIV should be covered in the objective of your SDL. So we will discuss the objective as per the lecture. Let us see one by one. Herpes simplex virus. The herpes simplex virus, also known as HSV, is an infection that causes herpes. That causes herpes. There are two types of the herpes simplex virus, 1 and 2. One primarily causes oral herpes, generally responsible for cold, sores, fevers, blisters around the mouth and on the face. But herpes simplex virus, second, primarily causes genital herpes, generally responsible for the genital herpes outbreak. Herpes zosters, which is also termed as shingles. The first sign of this herpes zoster includes tingling or painful feeling in an area of the skin, a headache, or feeling generally unwell. A rash will appear a few days later, and usually the patient gets shingles on chest and tummy, but it can appear on your face, eyes, and genitals. Cytomegalovirus is related to the herpes virus that causes cold sores and chickenpox. Cytomegalovirus does not usually cause symptoms. Some people get flu-like symptoms the first time they get cytomegalovirus includes high temperature, itching muscles, tiredness, skin rash, feeling sick, sore throat, swollen glands. If you do not have symptoms, they usually get better without treatment within about 3 weeks. Let us discuss the treatment about these cytomegalovirus, herpes zosters, varicella zoster, and herb simplex virus. Herb simplex virus and varicella zoster treatment, the drug of choice is acyclovir, which can be given by the oral route or available intravenous formulations. So the drug of choice for the herpes simplex virus, herpes zoster, varicella zoster is acyclovir. Valacyclovir is a product of prodrug of acyclovir. Prodrug. These are some pharmaceutical phenomenons of the prodrug. Prodrug initially it is inactive, but when it is given by the oral route by the liver enzymes, it is converted into active drug product. And the famciclovir is also product of the penciclovir, which is available as topical formulations. Mechanism of action, they inhibits the viral DNA polymerase, as we discussed in the replication of the DNA virus. So acyclovir inhibits the viral DNA polymerase. This question will be useful for your MCQs. Which one of the following is mechanism of action of acyclovir? And the options should be inhibits the viral DNA polymerase. Indications where it is used acyclovir in genital herpes, in the treatment of the genital herpes, herpes simplex virus and encephalitis, mucocutaneous herpes simplex virus infections, herpes zoster and varicella zoster, which is also known as chickenpox. Side effects include malaise, inflammation or phlebitis at the injection site, nausea, vomiting, rash, elevated transaminase level. Contraindication, if the patient is having documented hypersensitivity, should be contraindicated. And cautions, avoid rapid infusion because of the risk of renal damage. So it should be used cautiously with the renal impairment patient. So this is about the acyclovir, which is considered as a drug of choice for the treatment of herpes simplex virus infections. What are the alternate drug if the patient, or we can say the viral infection, herpes simplex viral infection is resistance to the acyclovir, which is the another option. So if the viral infection of herpes simplex virus is resistance to the acyclovir. Then which is the other options? So alternate drug is foscarnet, which is available as injectable solution. So there will be question for your MCQ. Which one of the following injectable drug is used in the management of acyclovir resistant herb simplex virus infection? And the answer should be foscarnet. What is the mechanism of action? Inhibits the viral DNA polymerase and reverse transcriptase in viral pathways. Where it is used, indications, generally it is used as herb simplex virus infection if the infection is resistant to the acyclovir. It is also used in cytomegalovirus rhinitis. So for the cytomegalovirus, which is the drugs you can give for the cytomegalovirus, is foscarnet. Side effect: fever, nausea, anemia, vomiting, diarrhea. These are the abdominal discomfort. In addition to this, abnormal renal functions, decreased creatinine clearance, headache, and seizures. So contraindications: if the patient having the documented hypersensitivity or cautions in the patient with the renal impairment. And if it produces a seizure, it should be contraindicated or used with the cautiously with the patients of the epilepsy or convulsions. Which is another drug for the acyclovir resistance herb simplex virus infection is cidofovir. Mechanism of action: inhibits the viral DNA polymerase and reverse transcriptase, which are the rate limiting steps in the synthesis of the virus. Indications: where it is used, cytomegalovirus rhinitis and the herb simplex virus infections. So for the cytomegalovirus, we seen the two drugs. The first one is the foscarnet and second one is the cidofovir, F and C, foscarnet and cidofovir. What are the adverse effects? Nausea, anemia, fever, vomiting, diarrhea, abnormal renal functions, decreased creatinine clearance, headache, and seizure. Same. Hypersensitivity and the renal impairments are the contraindications and the cautions. So we can say that foscarnet and cidofovir are used for cytomegalovirus infection plus herb simplex virus infection if it is resistant to the acyclovir. Then let us see about the influenza virus. It is estimated that influenza A infections account for 75% of confirmed seasonal influenza infections overall. So most common cause influenza is A. Influenza B infections account for remaining 25%, while most confirmed infections during the flu season will be influenza A, the most confirmed. Otherwise, we can say influenza B infections can increase late in the flu season. Let us see the management of the influenza A and B. influenza A and B treatment. The drug of choice for both influenza A and B. If there is a question, which one of the following is a drug of choice for the treatment, or we can say management of influenza A and B? The answer should be oseltamivir, which is available as oral formulations. Oseltamivir. What is the mechanism? It is neuraminidase inhibitor, interferes with the deaggregation and the release of viral progeny. Oseltamivir is a drug of choice for the treatment of influenza A and B, and it is from the category of neuraminidase inhibitor. Indications where it is used: in the treatment and the prevention of influenza A and B. Plus, oseltamivir, it is also used in the management of treatment of swine flu, which is generally considered as H1N1 influenza. And oseltamivir, it is available as a Tamiflu tablets, which was very commonly and widely useful during the infection of swine flu. Side effects include abdominal pain, conjunctivitis, ear disorder, insomnia, nausea, vomiting, and the vertigo. Contraindications: documented hypersensitivity to the oseltamivir, and cautions: patient with chronic cardiac disease, severe hepatic impairment, renal impairment, and the respiratory disease. The drug is used cautiously, which may progress the cardiac, hepatic, renal, or respiratory problems. So, drug of choice for the treatment of influenza A and B is oseltamivir, which is from the category of neuraminidase inhibitor, which is alternate drug. If there is a question, the patient of the influenza A and B infection and with documented hypersensitivity with the oseltamivir, which other drugs you will, which one of the following drug is useful to manage his infection, that is influenza A and B, or we can say swine flu also. So your answer should be zanamivir, which is available as aerosol, or we can say inhalational formulation. What is the mechanism of actions? Neuraminidase inhibitor interfere with the aggregation and the release of the viral progeny, same as oseltamivir. Indications for the treatment and the prevention of influenza A and B, and treatment of the swine flu, we can say H1N1 influenza. Side effects include headache, throat tonsil pain, cough, and maybe the viral infections. Other viral infections will attack. Contraindications: documented hypersensitivity, and the cautions is patient with respiratory disease. So here, if we compare about the cautions of the zanamivir and the oseltamivir. The zanamivir having low cautions only with the patient with the respiratory disease, so we can prescribe this zanamivir for the patient of chronic cardiac disease, severe hepatic impairment, renal impairment. So this zanamivir inhalation or aerosol having beneficial effect for the cardiac, hepatic, and the renal patient also. Now we seen the two drugs, influenza A and B treatment. The drug of choice is always oseltamivir. But if the patient is having the documented hypersensitivity with the oseltamivir, or if the patient is having the cardiac disease, hepatic impairment, or renal impairment, you can prescribe alternate drug zanamivir, which is available as inhalational aerosols. What are the alternate drug for the only influenza A treatment? Not B, only influenza A. And the alternate drug is rimantidine, which is available as oral formulations. Rimantidine. Mechanism of actions, it blocks the M2 protein on the ion channel as we seen in the replication of RNA virus, and it blocks the M2 protein, which is a rate limiting step in the formation of the virus. Indications only prevention and the treatment of the influenza A. Side effects include dizziness, nervousness, fatigue, headache, insomnia, nausea, and vomiting, which are the abdominal discomforts. Contraindications documented hypersensitivity, and cautions should be taken if you are prescribing this drug to the seizure, psychosis, CNS patient, and renal impairment. So if the patient having the only influenza A infection, the alternate drug available is rimantadine, which is blocks the M2 protein on ion channels. Which are the alternate drug available for influenza A treatment? Rimantadine and amantadine, both is having oral formulation. But what is the difference between this rimantadine and amantadine? Amantadine crosses the blood-brain barrier. What is the main difference? This amantadine crosses the blood-brain barrier, and that's why it is causes dopamine agonist activity and useful in the management of Parkinson's disease. Amantadine. Mechanism of action blocks the M2 protein on ion channel for the influenza A treatment, but for the Parkinson's disease, it is acts as a dopamine agonist because it crosses the blood-brain barrier. Side effects, hallucinations, dizziness, dry mouth, peripheral edema, constipation, and the orthostatic hypotension. Contraindications, documented hypersensitivity, untreated narrow angle glaucoma, and the breastfeeding women should be avoided with the amantadine, and cautions monitor for the depression, including suicidal ideation or behavior. So the best one for the influenza A treatment amongst the amantadine and rimantadine is rimantadine because it does not crosses the blood-brain barrier, and therefore the suicidal ideations, behavior, and depression will not occurs. So these are the management of the influenza A treatment.